Hello, and welcome to Partnering with Your ISD and School District around assistive technology. I'm Carolyn O'Hearn. I'm an AT-AAC specialist with AltShift, and AltShift is an IDEA grant-funded initiative through the Michigan Department of Education Office of Special Education. We collaborate with educators and families to improve educational outcomes for every learner by rethinking what is possible. This webinar is in collaboration and partnership with Michigan Alliance for Families. We know a little bit about AT already. You know what assistive technology is and what it's not. You know that AT must be considered for every student with an IEP, but maybe we don't know what that looks like. And you know that AT needs to be documented in the IEP. But what if you have questions? Who do you ask? What do you ask? How do you ask? So let's look at who we need to ask. So if you have a concern about your child's AT, ultimately, this is a conversation for someone on your child's IEP team. Depending on the nature of the concern, this could be something you send as a quick email. For example, how are things going with my child's ATUs? Or something that needs to be a more formalized meeting. Maybe getting more people together at the table to help brainstorm new solutions when a tool no longer seems effective, for example. But how do you know who on the IEP team to ask? Let's delve into that a bit more. Questions about AT use in general education classrooms can be directed to a gen ed teacher. For questions or concerns about AT use within the classroom or with training, or perhaps even if AT is being used at all, your child's special education teacher is a great resource. This person is typically, but not always, your child's case manager. They can also help direct you to other people on your child's IEP team. School districts often have different ancillary staff, speech paths, OTs, PTs, and some classrooms even have different therapists, depending on how the caseloads are divided. Your child's case manager can help direct you to the right person if they do not have an answer for you. This long list of ancillary staff is not exhaustive. There could absolutely be people on your child's IEP team that aren't listed here, which is why it's so important to know who is on your team. If your child has a visual impairment and receives support from an orientation and mobility specialist, see, one that's not listed here, that person could be a wealth of knowledge regarding AT supports that your child could use to navigate their environment. If you're not sure who would be the most helpful regarding a specific skill, you can reference the AltShift AT Skills Inventory. It's typically used by educators and administrators, but can absolutely be used by parents to identify who would have this knowledge in a certain area. A link to the skills inventory is available on the resource page at the end of the slide deck. In general, if your question or concern directly relates to your child and the use or non-use, or the need to explore an AT tool, educators and instructional staff would be the people to ask. On the flip side, if your question has more to do with the policies behind AT tools and services, an administrator would be your best bet. Administrators are ultimately responsible for the provision of quality education programs and services for students under their care within their programs. It is the administrator's responsibility to help ease the fears and trepidations of students, parents, staff, and faculty by advocating for good assessment, quality technological supports, integrity of content delivery, and a commitment towards implementation with fidelity across all aspects of the program. Administrators often are legally the only ones who can obligate the school to provide services and who have the responsibility to allocate school resources. Remember that assistive technology must be considered for each student with an IEP, and that providing and training of tools to help improve, increase, and maintain your child's functional skills fall under your child's right to a free and appropriate public education. But don't forget the students. According to the Michigan Administrative Rules for Special Education, or MARS, with related IDEA federal regulations, to the greatest extent possible, students should be members of the planning team that is putting together the education plans, programs, goals, objectives, and evaluations for their special education program. Your child's voice needs to be heard throughout the entire AT assessment process. Also, we can't forget you, the parents. You see a side of your children that most educators don't get to see, so your input is critical for an accurate depiction of what your child is or is not doing. One great aspect of the Michigan Alliance for Families community is the ability to connect with other parents. You aren't the first one with questions and definitely won't be the last one. So I encourage you to connect with other families to get input on how they've had their needs met or at least adequately and respectfully addressed in similar scenarios. So now you know who to ask, but how do you know what to ask? Are there big ideas you're missing? We often don't know what we don't know. And I can speak from an educator perspective. We don't always know what the parent doesn't know. Some of the frustration that occurs is simply a miscommunication and not understanding what is or what is not known already. So ask your questions. If you're in a meeting or receive an email and you need additional clarification, ask. As an educator, we don't always recognize that we're using jargon or professional language. So this resource is what will guide the remainder of this webinar. Assistive Technology Pointers for Parents was written by AT professionals Penny Reed and Gail Bowser, and they composed this workbook for parents. There are great examples and more in-depth explanations of the topics we'll cover in our short time here, and it's quite affordable. As of December 1st, 2020, it's free if you want to download the PDF yourself. If you'd prefer a more professional hard copy, you can purchase the book. Use the tiny URLs on this slide to take you right to the resource pages. So in this workbook and in this webinar, there are two sets of questions for parents, the preparation questions and the clarification questions. Preparation questions are those that you can ask yourself in preparation of meetings or conversations you may have with IEP team members. Clarification questions are those you can ask the IEP team members. As with anything with lists or ideas, these lists are not exhaustive. The workbook helps guide your questioning, but also leaves a space for additional thoughts to bring up to the team or to ask yourself later. You'll have the opportunity to add these and other questions to a Padlet as well. More on that later. This is how Reed and Bowser named the steps of the AT assessment process in their book. You may use or hear other names, or some steps may be combined or repeated, but for continuity, we'll keep these titles for today's webinar. So first step is consideration and referral. Every child's IEP team is required to consider whether that child needs assistive technology devices and services as part of the special education program. The most common way to do this is to discuss it during your child's annual IEP meeting. But if you or another IEP team member thinks that your child's learning difficulties might be helped by the use of AT, you can ask the team to meet to talk about introducing this at any time. When you are beginning to think that your child may need assistive technology, here are some things you can ask yourselves. When you work with your child's teacher to begin to look at their need for assistive technology, you have the opportunity to provide some of the very specific information that you, as an expert about your child, may have. Don't just come to a team meeting and say, I want AT. Help focus this discussion by identifying the functional area in which your child is having difficulty. Functional areas could mean any aspect or any skill set of their lives, such as talking, reading, writing, walking, eating, any other skill that your child might use. If you're completing a formal referral and asking to bring in new people with expertise to your child's team, identifying this functional area isn't enough. So be as specific as possible about the kind of change you want to see for your child. This is important. For example, do you hope your son will be able to communicate his wants, needs, and ideas? Do you want your daughter to be able to write more legibly? Does your son need to hear text read aloud in order to understand it? These are all very specific versus just saying, I want AT for reading, I want AT for communication. In addition, think about what you've already tried and what worked or didn't. This will help narrow potential tools or supports in the future. So here are some clarification questions to ask the IEP team during the consideration process. And the first question addresses accommodations and modifications. A modification means a change in what's being taught or expected from the student. Making an assignment easier so that the student is not doing the same level of work as other students is an example of modification, and that's not what we're talking about today. An accommodation is a change that helps a student overcome or work around their disability. This might be, but is not always, AT. Presentation and manner of response accommodations are often assistive technology, but setting and scheduling, such as time allowances, are not typically AT. But The use of assistive technology might result in some changing for setting and scheduling accommodations. It's all related. So ask the team what AT they're aware of for the specific functional skill you've identified in the previous section. Have they seen similar difficulties? Have they tried anything already? What worked? How well? These are all important things to know. If you or the team doesn't have the answers, especially at an IEP team meeting, that's okay. You can ask about starting the process and put your requests for an evaluation in writing. Schools follow specific timelines related to assessments. This section is all about evaluation, and your child's need for AT might be evaluated as part of his or her eligibility for special education, or once they're eligible, it might be evaluated separately. So there are 3 different outcomes if you ask for an evaluation for assistive technology. The team might decide that they have enough information to make a decision about AT, or they may decide to carry out an evaluation. Or, if they feel unable to make an AT decision, they might invite other individuals or specialists to join the team to help evaluate your child's need for AT. Some school districts have assigned people like an AT specialist or an AAC specialist or an AT consultant or a centralized AT team that may manage or assist with this evaluation. No matter how the team proceeds in assessing your child's need for AT, you as a parent are an important member of your child's IEP team and should have a role in the AT evaluation process. So here are some questions to ask in preparation for having a conversation about an evaluation. What's great about the internet these days is there are webinars and social media groups that you can talk to other parents and other specialists and see other tools that are being used. Have you seen anything that you think might help your son or daughter? So after you've prepped, here are some things that you could ask the IEP team during an evaluation or about the evaluation. Who on the team knows about the AT tools? And how will you be updated throughout the evaluation process? And how often will you be updated? The trial period is typically included as part of the evaluation, but Reed and Bowser felt it was important to specifically separate it out here. Trial periods of AT devices give such valuable information about how assistive technology might overcome barriers posed by a child's disability. Trial periods of AT allow you and your child to test drive AT until you find the device or combination of devices to meet your child's needs. Here are some things to consider. What changes in the child's performance are you seeing at home? What changes in your child's attitudes are you noticing as a result of trying this assistive technology? And these attitudes and performances could be about school, schoolwork, about the tool specifically, about themselves. Those are things to pay attention to. Your role as a parent in the trial period is to observe and report any changes in your child's performance or attitudes you see at home. If your child is using the AT in the home as well as at school, you may also want to learn about the AT yourself so that you can help your child use it. And similarly to asking about the evaluation process and when you'll be updated, it's very appropriate for you to ask how long the school staff expects this trial to last, who's managing it, and exactly what tasks and environments will be involved. Sometimes the AT does not work as expected, and a trial needs to be stopped or revised. Plan development is typically seen as planning in the IEP team meeting. IEP teams are responsible for determining every aspect of the IEP, including whether AT devices and services will be provided. This equally applies to IFSPs. Your role in plan development is to express your ideas and feelings about the AT, contribute information about what you see at home, and bring up any concerns you have. Every IEP team member should keep in mind the long-term vision for your child and take steps towards that vision. Here are some things to consider when planning. Depending on the tool and the outcome, AT is not automatically sent home. The IEP team is required by law to determine on a case-by-case basis whether the AT being included in the IEP is sent home with your child for use outside of school. If you believe that this tool is needed outside of school, then make that request during the development of your child's IEP plan. The decision to send AT home is based on whether your child needs access to their AT in the home and other settings in order to receive a free and appropriate public education, or FAPE. In light of the pandemic, many IEP teams are discovering that AT that once stayed at school now needs to be sent home with the student for them to access the curriculum. This also involves parent or caregiver training. Before remote learning, the answer to the last question about how much you need to know about the AT they're using may have been very little, whereas with the possibility of you as the parent supporting your child's learning at home, even more than anticipated, you might now need to know much more than before. Here are some clarification questions you can ask your IEP team. And again, with many students engaging in remote learning, there's an overlap of when and where students use their assistive technology. This is also an opportunity for you to see if your student owns the AT, so if they see it as theirs, and uses it when they can, or if they see it as work and need additional prompts to use it. This is something to consider moving forward. After an IEP team completes an assistive technology assessment and includes AT tools in a student's IEP, the work has just begun. Implementation planning, including strategies for classroom integration, daily schedules, and procedures, must be addressed if AT is to become a truly useful tool. Implementation planning is a time when parents can really help their children learn new things and to be more independent in their daily activities and routines. Here are some questions you can ask yourselves in preparation for an IEP team meeting. And notice that a lot of these are similar to the trial period. You want to make sure you keep an eye on your child's attitudes and performance with using the assistive technology. This doesn't mean that they're going to jump right in and be perfect and proficient with the tool right away. But if they're feeling down about themselves, or if they're not liking school anymore and they used to, it may be time to reconsider the tool that they're using. Here are some implementation clarification questions to ask your service providers. So if you're noticing a change at home, are they noticing changes at school? Are there any problems? How are they keeping track of what's working and what's not working? Perhaps the most important question to ask about AT implementation is, now that he or she has AT, what is it that we expect my child to be able to do? Ideally, the questions that the team began the AT processes with were, what functional task do we want this child to be able to do that he or she is unable to do at a level that reflects his or her skills and abilities? And is our expected outcome something that this child is developmentally ready to do? Once AT is chosen and implementation begins, other questions may arise. The team might discuss questions like, how soon will the child be able to do things AT was chosen to help with? Do we think he or she will be able to do them right away, or is there a need for training? And if training is needed, how long will it take? Is the training only about the operation of the device or the tool, or does my child also need to learn other skills like listening for important content or how to frame a sentence? Periodic review is the regularly scheduled review of a student's progress in all areas. Your child's progress on IEP goals is reviewed and reported at the same time as progress reports, like report cards, for all students. If your child has a specific goal for the use of AT, progress on that goal should be reviewed at the same time as progress reporting occurs in the school. Here are some preparation questions about the periodic review. And here are some things you could ask your IEP team. Look at your child's progress reports. Is AT mentioned in the updated sections? And if not, you can contact that educator and specifically ask about AT use. Transitions occur each year as students progress throughout the educational system. Some years there are simple changes to a new classroom in the same building or a new teacher. Other years they involve movement to different buildings or even an entirely new kind of environment. No matter how simple or complex your child's transition, the new start always means that steps must be taken to ensure that AT that was working well is continued, and AT use that was not working well is re-examined and improved upon. So here are some things that you can think about as you prepare for transition. What drawbacks or difficulties have you noticed, and how can you overcome them? Are there other situations or environment where the same technology might be needed? What transitions do you anticipate your child making in the next year or two, and will AT be needed in those settings too? And when you meet with your team, here are things you could ask the service providers. When changes involved in a transition are more significant, like the transition from elementary school to middle or from a school setting to the community, transition planning should reflect AT use. You'll probably want to meet with the new people who will be supporting your child and your child's AT use. As you prepare for this transition, it's important to focus on some of your planning on how AT will be used in the new setting. One way to ensure that AT is used in new settings is to identify the people who can explain and advocate for your child's AT use. Again, the best advocate might be your child. Self-advocacy is a powerful strategy that helps children and young adults ask for what is important to them and to take a more active role in their own lives. Students who use AT should, as early as possible, begin to make simple choices about their AT, like what color case they want for their device, or what vocabulary they'd like to be added or included. They should learn to ask for AT when it's not provided, explain to others the reasons they use AT, and participate in the selection, acquisition, and planning for their own assistive technology. Here are some of the resources that I've referred to in this webinar. The first link is the Assistive Technology Skills Inventory. You can find that on the AltShift website, or go right to this link that's on the slide. Some of the information came from Michigan Virtual University's article called Supporting Students with Disabilities in K-12 Online and Blended Learning. There's a link for that as well. And then, of course, most of this was derived from Penny Reed and Gail Bowser's Assistive Technology Pointers for Parents. In addition to these resources, we are a community, and so we've developed a Padlet. There are sample questions from Reed and Bowser's that have been organized in this Padlet, and you can go to it by https://padlet.com/altshift/MAF. And I want you to add your own questions to the appropriate column. And then you can ask your own questions too. So if there's something that doesn't fit there, or you have a very specific question you'd like answered or to hear other personal takes on, ask that in that first column. You'll receive resources or guidance on how to ask and who to ask on the IEP team, and maybe even get responses from parents who've experienced the same scenario. And as always, if you still have questions, contact your school or case manager. You can also contact your Michigan Alliance for Families Regional Parent Mentor. There's technical assistance available on the AltShift website by going to that link. Or you can email me directly, carolyn.ohern@altshift.education. There are other ways to stay connected with Michigan Alliance for Families. You can go to their website, or you can email them directly or call their phone number. You can find them on Facebook, Twitter, and their YouTube channel as well. I'd like to thank you so much for your time, and I'd love to hear feedback and add to the Padlet additional questions that maybe we didn't cover or didn't think of, things that you've experienced that you've wanted to ask teams before. Where would that fit in the AT assessment process? What types of things should be asked that maybe we haven't thought of? Michigan Alliance for Families is an IDEA grant-funded initiative of the Michigan Department of Education Office of Special Education and Michigan's Federal Parent Training and Information Center, PTIC, funded by the U.S. Department of Education Office of Special Education Programs.